Hi there. Thank you for tuning in and for sending your questions. Hi, I'm Dr. Clelia Lima, nurse practitioner with a passion for wellness. And today our topic is very, very interesting. We're going to talk about myth and facts about melatonin and your sleep. And I know many people have asked a lot of questions about what is this thing with melatonin and sleep. And a lot of things that we're going to talk today is going to be surprising. Also, by the end, I'm going to give you some updates on the pandemic and what's going on with Omicron and all the treatments. So, first, what is melatonin? Melatonin is a hormone that your brain produces in response to darkness, and it helps induce your sleep. So that's the relation right there. Melatonin work in the regulation of the circadian cycle. It's also known as the sleep-wake cycle or your internal clock. Okay, it's all the same. So light exposure during the night can reduce the production of melatonin. So what are you gonna do to make sure that your melatonin is not compromised? So you gotta make sure that you don't have any physical or mental issues that is decreasing the production of your melatonin. And we're gonna talk a little bit about that too. Also, some lifestyle, some habits that also put you in the disadvantage to have a good production of melatonin and a good sleep. Okay, so it's like a dance with the hormones. If you have trouble sleeping, most likely it's a red flag that your hormones are not well balanced. Several hormones has play a role in your well-being and your sleep, but the two that is very close together is the cortisol hormone and the melatonin hormone. So they kind of they dance in opposition, let's say that way. So in the morning, for you to wake up and be alert and A game, your cortisol level has to be higher and your melatonin down. In the evening, you need the opposite. Your melatonin has to be up to induce your sleep, and your cortisol levels going down to calm down and make you very ready to rest. But sometimes that is not well balanced. And then some problems with sleep, which is, very common, especially now with all the stress with the pandemic. So we're going to start with myth and facts, okay? Let's see if you can help me here. Melatonin and melanin are the same. What do you think? It is a myth. Melanin is a broad term for several chemical processes in the body, but usually people understand melanin to do with the skin pigmentation. So they sound alike, melatonin and melanin, but they're not, family, okay? They're not related. So the other one, let's see here who can get this one right. Melatonin supplements is the same as melatonin the body produces. What do you think? It is a myth, okay? The melatonin that you buy, in the pharmacy over the counter, it's synthetic. So the synthetic melatonin, it's not the same as your body natural melatonin. It mimics, yes, it mimics your body melatonin, but it's not the same. Did you know that melatonin is the most popular sleep aid sold in the United States? Very popular. It's number one. Now, a little bit of a statistic that I thought was very interesting. In 2017, melatonin products, all kinds of products, sold about $400 million. Okay. In 2020, melatonin products sold over $800 million. So no wonder that we know that the pandemic has created, aggravated, let's say, problems with sleep. So a lot of stress, a lot of, you know, uncertainty, and people are reaching out for uh, sleeping aids, and melatonin is the number one. So studies are not conclusive to say that melatonin has, you know, benefit for insomnia and all of that. But maybe you have traveled several time zones and you felt the jet lag. And for those people, some research shows benefit. So if you have jet lag or people that work in rotating shifts, they find some benefit in taking a little bit of melatonin to help to induce the sleep. So, but there's no guarantee that melatonin will work for you. So let's see another one. Melatonin is safe and there are no negative side effects. What do you think? It is a myth. Side effects from melatonin supplements are very minimal. If you take a low dose, very minimal side effects. If you take for short duration, let's say up to 3 months, usually people don't have side effects. But it is possible to have side effects. So, the most common side effects of melatonin is headache, dizziness, nausea, and drowsiness. But those are the most common. But I'm going to give you a big list of possible side effects. Most people don't have those, but it's good for you to be aware that it's a possibility that you might have that kind of side effects. Rebound insomnia, instead of helping you to sleep, makes it worse. Abnormal dreams, sleepiness in the morning, tiredness, depression, anxiety, irritability, aggression, restlessness, feeling hangover, mood swings, tremors, not all yet, increased weight, night sweats, chest pain, hypotension, abdominal pain, diarrhea, heartburns, mouth ulcers, dry mouth, pained extremities, dermatitis, itchy, dry skin. That's a lot, right? Again, most people don't have those side effects, but it's possible to have those. It's not, melatonin is not recommended if you have a liver disease. And also, it may increase the sugar and protein in the urine. So, those are things to be aware. And another one that is interesting, it can possibly decrease fertility. Um, some birth control pills, most of them actually, they have some dose of melatonin. So if you take melatonin by itself, I'm not saying that's a birth control method, okay? But it could decrease fertility, just to know. And also to be aware that if you need to drive in the morning, first make sure that you know how your body reacts to the absorption of the melatonin. And if you have to operate machinery, you know, just be careful because you may feel drowsy. Another one, fact or myth, okay? No need for medical prescription to buy melatonin in the US. What do you think? It is a fact. Most people know that you can buy melatonin over the counter. However, not everywhere is the same. So the U.S., United States, Canada, Brazil, there are other countries that you can buy over the counter, but in Europe you can't. So the United Kingdom, Australia, the European Union, melatonin is only sold by prescription, and they have some restriction on age as well. So it's not like, you know, everywhere it's so easy, just go and buy it. It has some restrictions in some places. Another one, melatonin is a supplement and has no medication interaction. What do you think? It is a myth. Melatonin may interfere with some medications. And I'm going to give you a list of very serious consequences, okay? So if you take medication for, if you take anticoagulants or antiplatelet drugs, it may increase your risk of bleeding and bruising. So don't take melatonin, even though it's over the counter. You have to have your doctor to make sure that you discuss with your provider to make sure that it's safe for you. Okay, if you take any drugs that are anticonvulsants, the melatonin may inhibit the absorption of these medications and then increase seizures. Don't play with that, right? Immunosuppressant. Also, if you have any condition that you take immunosuppressant, melatonin is very dangerous because melatonin increase the immune function. So it's going to be, opposite. Diabetes medications has the potential to cause hypoglycemia or hyperglycemia. It could be too low, too high. Also, if you take any medication that is sedative, any sedative, you don't want to have the compound effect because that could cause some breathing problems. And that's, critical. So it is important that if you want to take melatonin, talk to your doctor. Another one. It's safe to take melatonin if I'm pregnant or breastfeeding. Is it a myth or a fact? It is a myth because it's not conclusive. Any research that would say it's safe to take melatonin if you are pregnant or breastfeeding. So, because of the lack of research and studies to say it's safe, it's better not to. Okay, so still the safe side and just avoid it. Okay, now another one. Children can take melatonin. What do you think? Is it a fact or a myth? It is a fact, but there is a caveat to it. In Europe, remember, Europe is all prescription. Doctors recommend melatonin for children and adolescents with some neurological problems. And then they have a close follow up with them. So it is recommended, but by prescription in certain conditions. And also, even though it's over the counter, it's not recommended that you give melatonin to children if not prescribed or if not recommended by the pediatrician. So be careful with that. Another one. Melatonin decreases in advanced age. What do you think? It is a fact. As we age, and then I'm gonna let you just use your imagination. Which age would that be? Actually, we slowly decrease the production of melatonin. In the more we age, the less melatonin we produce, and that could explain why older people have trouble maintaining good sleep through the night and being refreshed because the hormonal production, it's not effective. So another one. If I take higher dose of melatonin supplement, I will sleep better. What do you think? It is a myth. And actually, we talk a little bit about the rebound effect already, right? So taking more doesn't mean that you have a better sleep. On the contrary, you may have the rebound effect and then you don't sleep at all. So, what is the dosage that I should take? So, first of all, the immediate release available from zero point 0.3 to 10 milligrams. It's recommended that you start with the lowest dose, and then you see how your body, reacts to it, and then you increase. But don't increase every night. Just give yourself a couple of nights to see how it works for you, and then you can increase little by little. But remember, just because they have available up to 10 milligrams doesn't mean that's the dosage you should take. Actually, I would not recommend that you take more than 5 milligrams. Most of the good effect would be up to 3 milligrams. If you take three, already is a high dose. If you take five, I would not recommend more than that. So just be careful and don't take too much. So just for curiosity, you may know that melatonin is available in very a lot of different ways. They have pills, tablet, gummies, liquid, transdermal patch. I don't know, so many kinds. Sublingual. Um, and if you take this slow release, just remember not to cut the pill because it's supposed to your body to absorb little by little. But most of the over-the-counter melatonin are immediate release. So another thing is important to remember that don't take melatonin more than 3 months, because if you take it for um, a situation that is a traumatic situation, stressful situation, and then you need a little aid, and then you sleep, and then you go back to your normal life, it's okay. But if you need for more than 3 months, it will qualify you for maybe chronic insomnia, and you need to have a specialist to evaluate your situation and treat the underlying cause, because continue to take melatonin may not working on the long run, and by missing, you don't want to be missing any serious underlying condition that it has to be treated in a different way. Okay, so just remember that. Just another good information here is about what time should you take the melatonin. It's recommended that you take 2 hours after you eat. Remember that we talk about the absorption of glucose and interference. So the best way is 2 hours after you eat. And the other thing is about the half-life of melatonin. So the peak of the medication is about 60 minutes, about an hour. Okay, that's the peak of the medication. So if you want to go to sleep at 10 o'clock, maybe you can start taking a melatonin around 9 o'clock, because now in an hour it's going to be the full effect. But the half-life is very short. Okay, the half-life of melatonin is 35 to 50 minutes. So in 35 to 50 minutes, you already have half of it, and then another 50 minutes, another half. So in about 5 hours, it's out of your system. So, and also the bioavailability of the melatonin is only between 10 to 50%. So it's kind of a big range, right? 10 to 50. But again, to do with the dosage and the production of what is actually in the pill. So it's like 90% of the melatonin is clear on the first pass of through the liver. So it goes away really fast. Another one here. I can trust the label of my melatonin supplement. What do you think? It is a myth. Melatonin is not regulated by FDA and is considered a dietary supplement. So there is no guarantee that you are taking what is written there. There is no regulation of the purity and the content. It's just a dietary supplement. So you don't know exactly how much you're taking, because it's not regulated. And actually, there was a study, very interesting. It was published in the Journal of Clinical Sleep Medicine. And they found that the content of more than 70% of the melatonin supplement more than 70% of the melatonin supplements, they had a variation that was huge. The concentration ranged from 83% less of the amount listed up to 478% more than was listed. So it's concerning when you see, that kind of variation. So just make sure that you talk to your doctor if you consider taking supplements and you take any medication, have any health condition. Talk to your doctor first to make sure that it's safe for you to take it. Okay. Now, one more. Some foods have melatonin. What do you think? It is a fact. Some research shows that some good levels of melatonin in some foods. I'm going to tell you which one they are. Tart cherries, bananas, plums, grapes, rice, cereals, some herbs, olive oil, wine, beer, milk, pineapple, orange. So some foods and some drinks, they do contain melatonin. So, but I don't know how much benefit you can take or how many bananas you can eat to get a good sleep. So it's just curiosity. And the last one, insomnia can be better. Insomnia can get better with the right treatment. I think you can guess that one. It is a fact. Prescription medication may be necessary if you have an insomnia that is caused by a trauma, by something that is acute. So there is a place for insomnia medications, but for short term, no more than 3 months. First, it doesn't work long term. And second, you have to discover what is causing the insomnia. The best treatment for insomnia, long term, is cognitive behavioral therapy for insomnia. And that is gold. People that have insomnia, struggling with their sleep for 10 years or more, they do the proper treatment with cognitive behavioral therapy and they get better. So it is important that you know there is hope. It's not overnight. It's not something that you do fast, but you can have a treatment. But it's not only that. You may have sleep apnea, restless leg syndrome, hormonal imbalance, anxiety, depression. So there are so many other things that you require medical treatment. So if you have insomnia, seek a medical professional that can help you to find out what is causing it and treat it. So there is hope. And some of you know that I have some videos here in my YouTube channel about sleep, because I had some personal sleep issues, but now I'm sleeping really well. So I have some videos about that. I also have 10 tips for better sleep. It's for free on my website. So it's just 10 very easy tips that has to do with sleep hygiene and stimulus control, and that is very helpful when you're dealing with your sleep, and make sure that you have a better sleep. So all of that is available for you free of charge. If you need a consultation, I'm here for you as well. Actually, sleep is my specialty, and I have a big passion for that. So just very quickly about updates on the pandemic. My view is all good news, because the trend is going down. Most countries is already on the down curve. So hopefully we're gonna change from pandemic to endemic, but still we need to make sure that we take our booster and do our precautions, because you want to make sure that we are protected and protect our families as well. So we still have available Molnupiravir and the Paxlovid, the medication, the oral medication that helps to decrease the viral load. So it is more available now. And if you need prescription for that medication, I can help you with that as well. So we're gonna be here again next Tuesday for another Q&A, live Q&A, and I appreciate your participation and sending your questions. Really make it more alive. Please subscribe to my YouTube channel, like my videos, and share with your friends. See you next Tuesday for another live Q&A. Keep moving towards your best self. Be healthy and feel well.